a lot of times it is super obvious. We understand that there is a first aid or an emergency situation, but other times it can be a little bit harder to identify, things like vomiting. Sometimes, my puppy woke up dry heaving last night and then my brain starts going, does he have an obstruction? Did he get into something? Why is he nauseous? What's going on? He never even actually threw up, but I was started to go through all of that in my mind. And without that expertise behind us, is there anything that we can do to identify when some of these situations like vomiting or, they ate something they shouldn't have, or maybe some sort of bite, wound, laceration, or something like that, where it's a little bit harder to tell? Is there any way that we can kind of guide pet parents in how to identify when that's an emergency situation that should be treated immediately?
Yeah, you bet. We can give some rules of thumb here. As an aside, my wife and I often wonder why Apple doesn't offer the dog retching alarm for your phone. I mean, nothing will snap you out of a deep sleep.
Oh, yeah.
So a couple of rules of thumb. And sometimes I think of this as regular vet, emergency vet. Like what's going to motivate me to tell somebody they need to pick up and go, no matter what the circumstances are, to get professional help.
Oh.
So rules of thumb, vomiting, diarrhea. If it's going for more than 24 hours and the volume is such that they're really worried that the dog is not able to rehydrate. So that's the real danger in the acute sense with vomiting and diarrhea, is that we dehydrate, we lower the amount of fluid that's in the body so down so far that they can no longer, it doesn't support the circulation system anymore. Mm-hmm. So what's that mean? It's usually about 10% of a dog's body weight. There's two other things that I use all the time when it comes to that. So the first thing is pinch the skin. That's probably the best thing we have for dehydration. And some breeds it doesn't work so well because there's a lot of fur. But for most breeds, find that spot where there's a little loose skin, pinch it, and it should go back quickly within a couple of seconds.
Yeah.
And then if it doesn't, then the dog's probably dehydrated. Another thing to do is look under the eyelid. That should always be moist. There should never be a time when the inside of the eyelid becomes dried out. If that's the case, dog's dehydrated and needs some help. Probably needs more help than you can give it at home. And then lastly, I use the capillary refill time, which is a fancy way of saying how fast when you push on something. For us, it's pretty easy. It's the back of the fingernail. But for dogs, most dogs that have pink gums, you can push on a gum and let it come back out. Point is, for your dog, find some place that's pink, press on it, and it should refill within 3 to 5 seconds. If it's longer than 3 to 5 seconds, then you've got a hypovolemia situation. So that's number one. That also works, by the way, for has my dog bled too much? Bleeding, first of all, let me switch over to bleeding for rules of thumb. So vomiting, diarrhea, your real concern there is hypovolemia or dehydration. Number two, blood. Blood looks terrible. 1 teaspoon of blood on the floor looks like the Texas Chainsaw Massacre. So oftentimes, if they're bleeding a little bit from an obvious wound, you don't need to worry about it if you can get the bleeding stopped, and that can wait till the next morning. Now, obviously, if the bleeding isn't stopping, you need to get them into a place where they can address that. So the other thing to remember is blood dilutes in water. So you can have 3 gallons of water and put 1 drop of blood in, and it will tinge that water pink. It's incredible, which also means that if you go outside and your dog is in the pool and there's a huge plume of blood around, don't panic immediately. Find out where that dog is bleeding from. It might just be a little easy cut to go. So how do you deal with bleeding? Direct pressure is your first, second, and third best friend. You can't go in and ligate arteries or suture things together. Please never use super glue. It will close the skin, but it'll also close bacteria in there, and you're just begging for a big abscess to form. So typically, we'll just say if it can't be addressed with direct pressure, meaning holding a cloth against that wound, and no matter where that wound is, head, abdomen, extremity, and the only time you ever change it out is if you're literally dripping out of the towel. Blood usually stops. So as we like to say, all bleeding will stop eventually. But in this case, try to use direct pressure as best as you can. And do not use tourniquets in dogs. Because of their structure, tourniquets are going to much more likely to permanently injure either the nerves or the muscles if we use it even appropriately in dogs. So if you're not trained in using a tourniquet and where to place it, don't use it. Just use direct pressure. If the bleeding doesn't stop within 15 minutes of using direct pressure, it's probably time to go and find somebody that you can help, who can find some help. And then the last rule of thumb is intoxication. Go see the emergency veterinarian. If you've got a good reason to believe that the dog has eaten something, and typically this is going to be chocolate, it's going to be rodent poisoning. For some reason, dogs just seem to love getting rodent poisoning, and it's going to be drugs. So cannabinoids, other drugs, either legal or illegal. They are not for dogs. They're not for cats. They tend to do bad things to those systems. That's not talking about CBD or other treatments. Those therapies, you use them by the directions. Usually those are very safe. But if you're using a THC, oftentimes dogs will get into gummies or other recreational marijuana, and that's a bad deal. So typically those need to be decontaminated at the veterinary clinic. There are no good emetics or drugs that make dogs throw up that can be given at home. There are some very good ones. Cats, not so much. Cats, despite the fact that cats seem to throw up at the drop of a hat, there aren't very many drugs that make them want to throw up. But dogs, heck, we can get those guys to throw up 9 times out of 10. And then the last thing is that sort of decontamination on that same line. If they get into something like herbicide or something on their coat, if it's a mild one, you know what's going on. You can get them washed off. Of course, you can get them to a professional groomer and make sure that they know what they're getting themselves into so that they can wear appropriate personal protective devices. But if the animal's ingested it, it's inside, get them to a vet.
Perfect. Awesome. That's great. That's usually one of the most common questions is like, well, can I just make my dog throw it up at home? Or, oh, it was only a little bit. Do I really need to, and I know that the consumption of marijuana in dogs and pets has shot up a lot over the last few years. So that's always one of those things where people are like, do I really have to? But very great to know, hearing it straight from the vet. Don't give your dog anything to try to make it throw up on your own. Step one.
And even if they do, Julia, sometimes people say, well, he had something, but then he threw up, so I think he's fine. Most of the time, even when we use our emetic drugs, the data tells us that we're only getting about 50% of the stomach contents out. And so even if we're using the heavy duty drugs that are going to make them really try to throw up their tail, they still will oftentimes only get 50 to maybe at tops at 70%. So we still need to go through the other decontamination protocols, and it can happen to anybody, by the way. I've had personal dogs that I looked down and they had the very characteristic bright blue clay on their lips, and I'm like, oh man, they just ate a rodenticide I got put out. It was a neighbor who put it out, and I'm like, oh, all right, we're going in.
Oh man, that's always a really scary one. But is that one of those things where, is there like a certain timeline in terms of certain of those poisons? Like how quickly do you usually have to get to the vet there?
Yeah, with any intoxicant, I would say don't pass go and don't collect $200. It's time to go, because there is a time limit. So for rat poisons, for other rodenticides that are anticoagulants, if you get them out within 6 hours, you're probably going to be okay. You still want to put them on a month of vitamin K supplementation, and they might not feel great, but they need to get all of that out of their stomach, because even a very little bit can be highly, highly dangerous. For other things like propylene glycol, antifreeze, there is a very distinct 6-hour window that you can get it out. After that, it's already converted by the liver into some really dangerous things, and it will result in kidney failure or certainly kidney compromise.
Sure. All right, so as soon as possible is really the moral of the story here. Don't wait if you see your dog has eaten something.
Digestion or intoxication, don't wait. With bleeding, wait 20 minutes and see if you can get it under control. Of course, if your house is filled with white carpet and white furniture, maybe you want to jump ahead a little bit, because that's your own. That's a non-medical issue.
Of course.
And then for vomiting and diarrhea, again, as long as you're in a place where the dog is safe and you're safe, it's okay to wait 24 hours.